Welcome to Steady Balance on Spotify, your space to understand the science behind balance and vertigo.
Hello, I'm Dr. Bulbul Gupta, Director and Head of the Department at Yatharth Super Speciality Hospital, Model Town, Delhi. So, vertigo is not the same as general dizziness. Vertigo means a false sensation of movement. It feels as though everything around you is spinning, tilting, or shifting when you're actually still. It matters how you describe your symptoms because that's what shapes the diagnosis. So, if you just say that you're feeling dizzy, it's a very vague way of defining it. But if you say that you feel spinning when you roll over in bed, it immediately points towards a condition known as benign paroxysmal positional vertigo, which is one of the most common causes of vestibular vertigo. Okay, about this myth that vertigo is a fear of heights, it is not. The fear of heights is called acrophobia, which is a psychological response to height. Vertigo, on the other hand, is a medical symptom related to a dysfunction in your balance system or equilibrium, as we say in medical terms. The confusion comes from everyday language, but medically, a fear of heights is completely different from vertigo. This is a very harmful myth that there's no treatment and you just have to live with this problem because it stops people from seeking help. It stops them from visiting a medical practitioner. And the actual truth is that there are many forms of vertigo which are perfectly treatable. For example, BPPV, as I mentioned, benign paroxysmal positional vertigo, it can often be treated with simple repositioning maneuvers like the Epley's maneuver. Vestibular rehabilitation has a strong evidence for improving balance and reducing your symptoms. Migraine, as we know, presents with headache, nausea, vomiting. However, there is a condition that we know as vestibular migraine, which can be diagnosed and it can be managed with a targeted treatment for the problem. And another condition known as Meniere's disease, while it's not curable, but it is manageable to a great extent. Patients can live a symptom free life with medication on a long term basis. So, actually, the issue is not that nothing can be done. The issue is that people need to reach out to the right person because the right diagnosis leads to the right treatment. So, when vertigo hits you, it feels pretty natural that you need to be in bed during those severe episodes and that it can help. But a long term bed rest actually slows down your recovery. The brain adapts to vestibular problems through movement and recalibration of the balance system. Avoiding movements for too long prevents this adaptation. We call this as central compensation. And that is the reason why vestibular rehab works. It's a controlled, gradual movement that retrains the brain to understand that imbalance and adjust accordingly. In some conditions, in some patients, a prolonged avoidance of movement can also contribute to a condition like PPPD, which is a persistent postural dizziness where dizziness persists due to heightened sensitivity and behavioral patterns in certain patients. So, feeling that there is something wrong with the brain is a very common thing, and it is understandable that patients are scared. But the reality is that in 90% of the patients, vertigo is due to a peripheral cause, meaning it comes from the inner ear and not the brain. Conditions like BPPV, Meniere's disease, vestibular neuronitis can be very, very problematic. They can give you acute symptoms and incapacitate you to a great extent, but they are usually not life threatening. They can be managed pretty easily. The central causes like stroke are also a possibility, but they are far less common. So, what we need to understand is that we don't need to assume and think about the worst. We just need to get properly evaluated. Okay, so getting your test as normal does not always mean that there is no problem. There are certain conditions related to the vestibule or the inner ear which are diagnosed clinically and do not come up on tests, especially when your symptoms come and go. For example, conditions like vestibular migraine, a persistent postural dizziness, and episodic conditions like BPPV or Meniere's disease. When you investigate these patients, they might all come out to be normal if the investigations are done between episodes, that is when the patient does not have any actual symptoms of vertigo. So, if your symptoms are real and persistent, normal tests are just one part of the picture and not the whole picture. So, there are three basic takeaways from this. One is that you need to describe your symptoms clearly in your own language. That leads to a better diagnosis. The second is that treatment exists for many vestibular conditions, but it starts with the right diagnosis. And the third is that a recovery, a complete recovery, or a near complete recovery is possible. With the right approach, most people can live a meaningful life, a good quality of life, and improve their daily life. Thank you.
A public awareness initiative by Dr. Reddy's. This communication does not substitute advice of a medical practitioner. Please consult your doctor for any medical advice.